Hello, my name is Marcia Rankin. I'm a Service Development Manager within NHS24 and within the Scottish Centre for Telehealth and Telecare team. I joined the team in April 2011 and have since been responsible for the Paediatric workstream. The Paediatric workstream forms one of several workstreams within the Scottish Centre for Telehealth and Telecare. It has been live since 2006 and has deployed a number of pieces of technology. It has rolled out several training programmes and has raised awareness for telehealth within paediatric healthcare in Scotland. Today we have around 6 or 7 projects live, and now I'm just going to take you through some of those projects and the team members that are involved in them. Starting with the team members, we're a small team of 3, myself and 2 telemedicine nurse specialists. The nurse specialists help to provide a clinical overview and influence the service redesign as we conduct that to ensure that it's clinically safe and sound. They also act as the patient representative during that phase as well. They support a lot of the project management activities and roll out a lot of the training activities as well. The projects that we have live within the workstream include unscheduled care, decision support, care at home, maternity telehealth, telehealth for children think tank, support for managed clinical networks, children and adolescent with mental health services, and child protection. I'm just going to take you through each of those projects now so you know a little bit about what we do in that area. Starting with the unscheduled care piece, this project has been live for over a year now. It involves 6 rural general hospitals and 4 receiving centres within Scotland. The RGHs are primarily in the north of Scotland, and the 4 receiving centres involved include Rigmore, Aberdeen, York Hill and Edinburgh Hospital for Sick Children. The original intention for this project was to support the current methods of decision support, which are chiefly conducted when a patient presents. They use the telephone to contact a paediatric consultant in a receiving centre and take advice on what to do with that patient, whether they can be cared for locally or whether they need to be transferred. We're looking to reinforce that, as I say, with video conferencing, whereby the specialist can see the child in question and can help with a more informed view of whether or not the child can remain or whether indeed it needs to be transferred to a receiving centre. Over the last few years, the team have been looking at how families with children with spina bifida or palliative care needs may benefit from having technology in their home to support their care package. We've investigated using webcams and laptops, and we did discover that laptops were the most favoured piece of technology with the families in question. The families were actually incredibly supportive given the emotive and difficult phase they were going through of having technology in their home. What it helped to do was make them feel more connected with their clinicians, so feeling less isolated, but without any intrusion into the home. Encouragingly, we found that some of the older patients as well found additional uses for the technology. One of our 13-year-old spina bifida patients actually began using the laptop in his home for accessing social media in relation to his condition, and he found that really encouraging. We're just wrapping up the work that we've done in Care at Home to date with a view to identifying the lessons learned and ideally taking these forward to make recommendations for future work in this area. We also have a piece of work looking at the options around maternity telehealth. Encouragingly, this piece of work was born out of our unscheduled care project, whereby staff in the maternity unit at Oban were keen to see the investment in the technology in their ward reused for additional purposes. So we're currently investigating and designing a solution where we can use video conferencing for patients and members of the public who may want additional support after the birth of their child. And we are investigating all the stakeholders involved in this piece of work, including the local community health workers, the GPs and the maternity staff in Oban, to understand exactly where the technology can complement the current service. Other work we have going on includes the Telehealth for Children think tank. The Telehealth for Children think tank is a redesign of our old steering group. We reworked the terms of reference for the group and established a core group of interested paediatric stakeholders. We reworked the objectives and the challenges that we put to that group as well. So we have asked them to identify good solutions for telehealth in paediatrics across Scotland, but we've also given them a tough criteria to scrutinise their work against. We also recognise the importance of the managed clinical networks in the delivery of healthcare in Scotland, but also as a network themselves in sharing and communicating. To that end, we have been providing support to managed clinical networks of a paediatric nature across Scotland, in so much that we have trained people in using video conferencing, and this has allowed them to cast the net quite wide across Scotland to ensure that specialists can attend meetings from far-flung places. We've done some work in the area of children and adolescents with mental health issues. Similarly to our care at home work, we have been looking at how technology can complement the way that we deliver services to date. We're working with the west of Scotland and the north of Scotland in this area, and we'll soon be engaging with SEAT in this area as well. We do feel that actually there's a great role for technology to play in the delivery of mental health services, and we're working with the service development manager who leads our mental health programme to see where we can complement both the adult and the children's delivery of service. A lot of work has gone on in the way of paediatric telehealth in Scotland, and there are lots and lots of lessons learned. We find that involving clinicians at the start of the process and keeping them involved in the design of the service is the best way to ensure their interest and their buy-in and the likelihood of their use of the technology for future. We also feel that training is absolutely key. It's essential that staff who are going to be using the technology are trained not just to use the technology, but to test the technology on a regular basis. So when that need arises to use it, it's absolutely commonplace to them and they have confidence. It's not a burden, it's actually just a helpful addition to what is going on. So we are learning lots and lots about how telehealth and video conferencing can help the paediatric healthcare service in Scotland. And there's lots and lots more to do. We are investigating the use of various different types of technology, wireless technologies for ward rounds with the use of tablets, and potentially the use of satellite transmission in some of our more remote and rural areas. We'll continue our work in each of the areas pre-mentioned and are looking forward to the projects that arise from our Telehealth for Children think tank.